Hi, my name is Jeanette, and I work for Mindful Health Solutions. Today, my colleague Emily and I will be speaking to psychiatrist Dr. Albert Wertz. Dr. Wertz is one of the providers opening our new clinic in Seattle.
Could you please tell us a little bit about your background?
Yeah, so I'm a board certified psychiatrist who's been working full time since I was 15 years old. Been married since I was 18 and currently have kids in high school and college. I have psychiatric experience that ranges from inner city San Antonio to rural Washington here in Wenatchee, and also experienced in variable settings such as inpatient, outpatient, and hospital ER consult work. So pretty well rounded.
Yeah, I guess so. Thank you, Dr. Wertz. Um, could you tell us what drew you to Mindful Health Solutions?
Yeah, so in looking through things, I wanted to offer more to my patients just beyond traditional med management options. Always been interested in TMS. I had exposure to it when I was in residency. I visited a couple of private practices, and I'm excited about expanding treatment options into new and upcoming modalities like the esketamine options and psilocybin, and new research coming up on the horizon.
That's awesome. What is it that you really like, or what interests you about these alternative treatment options?
Yeah, so medication, hits the whole body and it can have a lot of side effects. TMS, it's targeted to the brain, so there's less interaction with the rest of the body. And they're a little bit more fast acting, so medication can take a while, and a lot of people through clinical trials end up becoming treatment resistant. And so, offering different options in your tool bag can definitely give people hope and get them towards remission instead of just treatment.
Yeah, absolutely, absolutely. Um, Switching gears a little bit, what's your background in Seattle, or what's your relationship with Seattle like?
Yeah, so I travel to Seattle quite frequently. It's where I get all my ethnic food because I don't have a lot of access to that in Wenatchee. But I live in Wenatchee, Washington. I've been here for about 5 years so far, since 2017. I came here since I graduated from residency. My dad and my grandparents lived in the Pacific Northwest, and when I visited the Pacific Northwest during medical school and um, doing rotations at the Psychiatric Center in Corvallis, Oregon, I just fell in love. We were here during October and the fall colors, leaves falling, the beauty, the forestry, everything compared to where I was raised in West Texas. It's just amazing here. So we came up and we've been here ever since.
That's amazing. I haven't been out that way yet, but I really, really want to. Like,
Yeah.
that's definitely like a dream place to visit.
Yeah.
Um, yeah. And what are you excited about with Mindful Health Solutions opening up their new clinic in Seattle?
Yeah, so improving remission attainability is a great option for treatment-resistant depression. We do currently have TMS and ECT options within Seattle, but we don't have enough. So patients definitely have a lot of issues with barriers to care. Washington State is one of the lowest access to care states in all the United States. So the ability to increase access and improve access to care is great.
Yeah, you really can't have enough, right?
Exactly.
Yeah. Um, and what kind of impact do you think? Because now with us moving into Washington, it's not just Seattle that we're able to, impact. We can impact the state as a whole. So, what are your thoughts on telepsychiatry and kind of impact that that can have on the state of Washington?
Yeah, definitely. With the business model that we have, the combination of in clinic and telehealth options allows us to see patients, throughout the state, and wherever they are, as long as they have internet access and a confidential area to have an appointment that's safe for them to have a meaningful conversation. So if it's at home or at work or in their car, or anywhere in the state with internet access through cell phone, etc, or if they want to come in clinic and see us in person, we've got the access with Mindful Health.
Yeah. And I think that's one, exactly. I think that's one differentiator for us, is that we're not just telepsych or telehealth. It's where a lot of companies they don't have that in-person option at all. And being able to offer that, I think, is really a huge benefit for us and for our patients.
Definitely helps foster better relationships with our clients. If they can't meet us in person, we can meet them virtually. Some visits virtually, some visits in person. It's fantastic.
Awesome. And I think I had one more question. Oh yeah, so any lasting or parting thoughts on what you want Seattleites or people from Washington to know about mental health or mindful health solutions?
Yeah, just don't accept that, depression is at your status quo, that you haven't been able to achieve remission, and that your current access to treatment is all there is. Definitely give us a try, give us a chance to make a meaningful contribution in your life. We have options like TMS, esketamine coming up, and further expansion. Just don't accept that you've reached a plateau. Let us see if we can break that and achieve remission. Never give up.
Yes, there's always another thing to try, right?
Definitely.
Awesome, thank you. And Emily, did you have any other questions?
I don't think so. If you want to expand a little bit more on how you work with patients and how you plan on implementing that, that would be great.
Yeah, so I use a very patient-centered approach to treatment, often combining psychotherapy and additional to med management. I don't think medicine is the end-all, say-all for treatment of patients. They need a combination of therapy as well, and also meaningful life change. And I want to, you know, use the least amount of medication necessary to achieve a meaningful change in their life, because medicines do have side effects. So that's not the absolute indication of everything. So we need to do a combination. We need to work on lifestyle change, build coping skills, engagement, and frequent follow-up is commonly associated with that, and our ability to work patients into our schedules regularly. If they need to be seen weekly, we can do that. If they need to be seen every couple of weeks, or work them further out to monthly or just maintenance follow-up, we have that ability.
So that there's somewhere where they're not just getting pushed medications and then left, So
Definitely.
Awesome. Well, thank you so much for your time today, Dr. Wertz. We really appreciate speaking with you, and we're really excited about the Seattle opening.
Definitely. I'm excited about it as well.
Thank you.
Dr. Wertz is just one of the providers opening our new clinic in Seattle. Currently, our Seattle clinic is only taking telepsychiatry patients. However, our doors are scheduled to be open on October 1st. If you're interested in making an appointment for any of our other treatment options, then please give us a call at 844-867-8444 or email us at intake@mindfulhealthsolutions.com to book your appointment in advance.